Well, here we are. I think we're on the air, and this is my first endeavor at a YouTube channel. My name is Dr. B, and I welcome you. We're going to explore a number of things on this channel over the next several months and hopefully years. I think the first topic that I want to spend some time on is something that I know about, and that's medicine. I practiced for over 35 years, and I don't pretend to have you send me your symptoms and have me diagnose and treat, but my main focus here on this channel is to educate you about the various disease processes and hopefully a little preventive medicine and help you understand the maladies that affect our bodies. I also live in the state of Idaho, and there's some pretty interesting places around here. And I thought I might throw in a little video of some interesting places now and then just general topics. So I'd actually like you to become involved and send me questions you might have that I could be helpful in educating you about certain health questions. So the first thing we're going to talk about on today's channel is something that's pretty near and dear to me because it affected me. And I had to cut my career short in medicine because of it. And it's a disorder called anterior ischemic optic neuritis. What does the word ischemia mean? Well, it means lack of blood supply. And basically, in layman's terms, it's kind of a mini stroke to parts of your retina, the part that has the cells that allow you to see through your optic nerve. And that ischemia causes some cell death and leaves you with some visual deficit. The disease process actually just strikes an unknown cause, really. Things we're going to talk about that may be predisposing factors, but basically you wake up one morning, as I did, and you're not seeing as well. I thought I had something in my eye that was interfering with my vision. And my partner said, "Hey, Ted, you better go see an ophthalmologist immediately," which I did. And they put me through a number of tests and found out that what I had is ischemic optic neuritis. It's a disorder that affects about 8,000 Americans. So in the United States, about 8,000 people a year. So it's not a very common disorder. And I'm sure around the world there are many others that suffer from this disease. Obviously, visual issues and vision issues are a problem all over the globe. But anyway, about 8,000 people. It usually affects one eye, but in about 20% of patients, it can, as it did in my case, affect both eyes, which really is quite devastating from a standpoint of the things you like to do: read, drive your car, and watch television and participate in life. But life will go on, as I'll tell you here in a few minutes. The risk factors for ischemic optic neuritis are diabetes, much more common in patients with diabetes, probably because of the vascular component of diabetes. Number two, high blood pressure or hypertension. And so that's another risk factor. Three, very high lipid levels or cholesterol levels can be a risk factor for ischemic optic neuritis. But probably the most common cause, and what they think happened to me, is a congenitally small optic disc. Now, this is where the nerve cells get together to form the optic nerve, and it's a little opening in your eye. And if your optic disc is congenitally small, we call it a crowded disc, then it encroaches on the small, tiny capillaries or blood supply to your optic nerve, and you develop some cell death of nerve fibers, and you develop visual impairment, which I have. Not to whine, but we'll get to that in a minute. The diagnosis is basically a diagnosis of exclusion. There are other things that can mimic optic neuritis. One is MS, multiple sclerosis. The other is an arteritis or inflammation of blood vessels like temporal arteritis or giant cell arteritis. And tumors can cause a mimic optic neuritis. So that's another risk or another differential diagnosis. Unfortunately, once you get it, you have it. And there's very little that can be done. I mean, in my case, when I developed this visual disturbance, they put me on high-dose steroids, which is pretty common treatment, although I don't think it does a darn thing to obviate the disease process. And they put you through a lot of tests, MRIs, blood tests, blah, 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 to see if you have any other comorbid problems. Oh boy, I'm getting some emails in. It's probably not from you, so because I haven't posted this yet. But treatment basically involves treating your symptoms of low vision. And in my case, I was very fortunate. My ophthalmologist sent me to the Idaho Commission for the Blind, which is a low vision clinic treating hundreds of patients in Idaho, in my locale, with low vision. And they do miraculous things. So one takeaway, and we'll go into that in more detail in a minute, one takeaway is if you have low vision, seek out and see if you have a low vision clinic with your Commission for the Blind, and make an appointment so you can be seen. My doc actually loves low vision, and he's an optometrist, and he comes from eastern Idaho 4 days a month and sees nothing but low vision patients. And it's so gratifying to him when people actually can have their low vision treated and improve their quality of life. Well, what he did for me, I walked in and I said, he said to me, "Ted, I think I can help you." And I said, "Oh, come on, really?" He said, "Yep." And what he did was fit me with a couple different pairs of glasses. And I'm going to show these to you now if I can get these darn glasses off. The first is a rose-colored glass. And the purpose of this, on a sunny day in particular, is to cut down on glare. And the glare actually interferes with your vision. And so these rose-colored glasses really help me on a very sunny day. These really are my sunglasses now. And people think I'm trying to be cute, but no, they actually serve a legitimate purpose to cut down on glare. The other thing he did, and again, I hadn't driven a car for a whole year. My wife took me everywhere, and I'm a pretty independent sort of cuss, and to all of a sudden be dependent was absolutely devastating. My wife was wonderful. She was very helpful. But here we go. Here's my driving glasses. He got me back in the saddle again, and this is called a bioptic glass, or bioptic glasses. You can see here, it's a telescope. And it allows me to tilt my head forward, look through that telescope, and see things. The two things I have going for me are light and magnification. So this magnify things, it allows me to be legally able to drive with 20/40 vision. So when I drive, I wear these glasses, and it allows me to get around town. I actually still drive on the freeway. Drove to a small town a couple hundred miles from here the other day with my wife and did just fine. And so they've really given my life back to me, and I'm so grateful for Doc getting me these glasses. Now they're not cheap. I'm not going to lie to you. They're several $100s, but they're certainly helpful in changing my life, and so for that I'm very grateful. So that's ischemic optic neuritis. I have to tell you, I still play golf. I drive a car. I go fishing. I have a fishing boat and allows me to go fishing with my buddies. Do a lot of things. I love my computer. I fly a drone. I mean, I'm very, very active. So if you have low vision, don't give up. So keep your chin up and don't give up. But if you can find a low vision clinic, please take advantage of that, because they can do some wonderful things. I have special devices that allow me to magnify stuff. Again, things I've got is color, brightness and magnification. And you can see that this magnifies and allows me to read. It's slow, but I can read. So it's pretty cool. And that came from the Low Vision Clinic at the Idaho Commission for the Blind. So anyway, I'm going to sign off for today. This is our first endeavor at this. I'd like your comments. If there's things you want to talk about or questions you have about certain medical illnesses, I'll give it my best shot. And so I'm going to post this and look forward to hearing from you. So this is Dr. B signing off. Have a great day. Bye-bye.